Hello everyone, welcome and thank you for joining in for our webinar today. My name is Ali Tahir and I am a lecturer at Institute of Space Technology, Pakistan. This webinar is being hosted by NCTSA, a project of Higher Education Commission, Pakistan, led by Institute of Space Technology. This event has been organized by Geospatial Society. We have 4 experts here today to talk about the extremely important topic of role of GIS in COVID vaccination. We'll be talking about the role of geospatial technologies in COVID-19 vaccine distribution and post-vaccination tracking, especially in developing countries. Before I introduce the guests, I'd like to give you an idea of what to expect. After the introduction of the panelists, I'll ask them to start with brief statements. Then, in the course of the hour or so that we have together, I hope we can amplify to draw out from them some broad range of answers or thoughts on the topic. I'll kick off the conversation asking questions that draw out some of the high-level themes. And then we'll open up the floor to give you an opportunity to ask specific questions. If you have any questions during the webinar, please type them into the chat box. We'll try to address as many questions as possible in our question and answer session. And now I will briefly introduce the members of our distinguished panel. We have today with us Dr. Este Geragathy, the Chief Medical Officer at ESRI. She has worked as a Deputy Director with California Department of Public Health and as an Associate Professor at the University of California, Davis. Dr. Geragathy is the author of numerous health and GIS peer-reviewed papers, book chapters, blogs, and technical papers. She has lectured extensively around the world on a broad range of topics that include social determinants of health, open data, climate change, homelessness, privacy issues, and COVID-19 public health preparedness. With us, we also have Dr. Orhan Altan. He's a professor at Istanbul University, an honorary member of the Science Academy, an honorary fellow of the Indian Remote Sensing Society. He is also the former president of International Society for Photogrammetry and Remote Sensing. Our next guest tonight is Dr. Ali Tahir, assistant professor at NUST. He holds a PhD in geoinformatics from School of Computer Science and Informatics at University College Dublin, and his postdoctoral from the Geoenvironmental Research Center, School of Engineering, Cardiff University, UK. He has been actively working with local and international industry and delivered many R&D solutions for real estate, improved water and sanitation, forest management, air quality monitoring, and GIS ERP integration. And finally, we will have with us Dr. Hammad Gillani, Assistant Professor at Department of Space Science, IST. He holds a PhD degree in photogrammetry and remote sensing from Nanyang Technical University, China, and postdoctoral research at the University of Illinois, USA. He has served 7.5 years at International Center for Integrated Mountain Development, Kathmandu, Nepal. He works in South and Southeast Asian countries at cross-cutting issues where policy formulation and decision-making directly benefits from spatial data, geospatial data, tools, and techniques. With no further ado, I will invite first Dr. Geragathy to give us her thoughts. Dr. Geragathy.
Thank you very much. This is exciting. Thank you for inviting me to be a part of this esteemed panel. I have to say that I think that GIS is absolutely essential in the efficient distribution of vaccines around the world. And I'll just make a few points of how I think about this I actually think of it as being organized in a way around a supply and demand curve. So if you think of the beginning phases of vaccination where you have low supply of vaccine but high demand, that's really your initial planning phases. And you're going to be using the traditional kinds of facilities that deliver vaccinations, pharmacies, hospitals, and clinics. And you're going to need to think about the population and how you're going to phase them. And we've seen this around the world. And then you match those to accessibility calculations. How well can the population reach the given facilities? So that's the first phase. Then you get to a phase where the supply increases and your demand remains high. That's very good. We would call that a surge situation. And you enhance your vaccination network at that point with really intelligent selection of new vaccine venues, considering we all have budgets to live by and only so many personnel that can be delivering vaccines. So you want to find those vaccination spots that are going to serve the most population as that supply and demand increases. The next thing that happens, though, we're starting to see some of this in the U.S., is that there is a continued high supply of vaccine, but the demand starts to dwindle. And so there are different ways you can use GIS there. You want to iteratively search for gaps in your network. Who is not being vaccinated? Who's not being served? Because we all want to ensure to the extent that we can that we're delivering the vaccinations equitably. So you pull in social and cultural indicators of vulnerability, medical indicators of potentially poorer outcomes. And so you're iteratively using your GIS to find those gaps. So that's still a site selection opportunity, maybe looking for things like possible drive-through vaccination clinics. But you also want to start your outreach to homebound individuals and hard to vaccinate individuals. And GIS is great for optimizing routing and organizing that workflow. And then finally, you're going to have your hardest population to reach, which is those that are vaccine hesitant and need more information to help support their knowledge and their decision making. And GIS can be used for that as well, not only to identify pockets of hesitancy, but to pull in community partners and to help address potential resonant messaging for those populations. Finally, outside of vaccine supply and demand, there's some operational things that GIS is very good at, and that would be your vaccine management supply chain inventory concerns. GIS can track those, as well as having a really clear communication strategy from the Ministry of Health, Health Department perspective, because people need information, they need to be connected to the vaccine venues, they need to determine their level of eligibility. You want to be able to share community progress with dashboards and even potentially highlight vaccine champions across a country or a community, and GIS can support all of those. So in a nutshell, I think that GIS is essential to all parts of the process. You're on mute. Yeah.
Thank you very much. Now let me turn next to Dr. Orhan. Dr. Orhan, what would you like to say?
To unmute my micro. Okay. I hope you can hear me clearly. And Dr. Geragathy has made a very good introduction to the GIS and use of the vaccination. The GIS is, of course, all of us know, is a wonderful tool that we can use for all social and other phenomena and combating with all the disasters. I call also COVID-19, this pandemic, also a disaster. But every GIS has to be fed by data. And therefore, I will just use the opportunity to the success of this GIS from the data perspective. And the data perspective, I will use it as in 2015, at the United Nations General Assembly, there was a very big declaration signed by almost all, more than 230 countries, member countries, this UN resolution and this 2030 agenda. And in this 2030 agenda, the number 3 of all these sustainable development goals is the health. And a very important one in this General Assembly resolution is a phrase. A phrase says that we should promote public-private cooperation to exploit the contribution to be made wide range of data, including Earth observation and geospatial information. And this was one of the key factors in the last 5-6 years after the acceptance and this made declaration to all countries. And the success of this under the 17 goals, which has been described by this declaration, number 3 is the health, good health. And in order to look for the goal, then the targets, and after the targets there are indicators, and as well as the GIS, there will play and still playing a very important role. Now I'm coming back to COVID-19. Dr. Geragathy has made a very good introduction by the supply chain and etc. Coming from the delivery of the vaccines to the supply chain and also then to the end point where the vaccination is made, and then connection with the needed persons in the country, in the region, etc. My point here is we have to make clear that the vaccination reaches every person, every individual in the region. The second one, in order to convince the non-vaccination, I say, or against the vaccination persons, we have to show them the success of the vaccination. And therefore, we have to trace these individuals so that they can have a success story to the other people who is just hesitating to have this vaccination. This is the similar not only in US, in many countries. And this comes from the religion, this comes from other beliefs, etc. But we have to combat with this without any success story. You cannot. And this is for the first time that in a short period, the science has developed these vaccinations. In the last years, it lasted almost 3-4 years to have a successful vaccination process. But now, in 9 months, even in 9 months, they delivered us the vaccination. This is a success of the scientific evidence, and the scientific evidence made decisions should be exploited to all the societal partners so that the society believes also in science. And therefore, GIS and GIS tools is very essential in order to let the people decide on the success of the vaccination. This is from my side.
Thank you so much, Dr. Orhan. Now I would like to ask Dr. Ali to say something.
Okay, thank you very much, Anika. And first of all, I would like to thank NCGSA for providing this opportunity to share our views. So as my, panelists, they have very rightly introduced, in the nutshell about this whole phenomena, which is pretty much global in that sense. So my focus will be mostly on the stakeholders part of it. Of course, Dr. Orhan has mentioned the data part of it, and Dr. Este has mentioned the overall, the GIS part and multiple components of it. So I think the stakeholders are the key here. Because if you look at the GIS, the basic definition, so users, we have, what we teach also, that users are one of the main components. And again, here we have multiple stakeholders, as has been mentioned at Ministry of Health, and of course, all the departments under that. Because what happens is, unfortunately, the challenge I would say here is that different departments sometimes collect different kind of data. So this data availability and data sharing, this has been, the challenge, at least if we talk a bit in the local context. Of course, there are countries where the data coordination and there are, better systems in place. For example, they have these spatial data infrastructures in place. In Pakistan, the effort is still going on, to have our first national spatial data infrastructure. So once that framework will be up and running, so I think we will be in much more better position to take informed decisions and, to efficiently plan all these vaccination or otherwise the pandemic situation. So that's one of the things. The other thing is about the vaccination. So I would like to highlight some statistics of Pakistan, which are pretty much local. So at the moment, as per the official statistics, we have about 0.44% people only vaccinated. So imagine this is even less than 1 million of people. The situation has been gradually improving. Up till now, about 1.9 million people have been vaccinated. But I think the process was slow. As Dr. Este also mentioned, that there are a couple of phases, 3 phases, I think, in the overall vaccination process. But at least we are, looking, the situation is improved. And only yesterday, I think even age group between 30 and 39, they can also be vaccinated. Now, of course, this pandemic itself or any epidemic, this is a very much, location phenomena. And as we all know about the basic GIS, so it's all about the location intelligence. How better early we can map the data and accordingly we can, plan our allocation. So we're talking about GIS. We also talk about spatial decision support system. So what happens is that we attach a model, a computer or a scientific model with that GIS in order to, forecast and predict the results. So I think that is also what is required. So in terms of GIS, as we know that there are a range of spatial analysis which can be performed. Some of them were mentioned by Esther, but for example, we know the hotspot analysis. So now, for example, I was earlier looking this morning few maps. I found one Bing map is one of the global portal, which is actually mapping the global, COVID cases. But the first time I also saw the vaccinations, you can see a big circle or a smaller circle depending how many people have been vaccinated within that country. But so far, I have not seen the relationship between, for example, in a particular given area, if you have this spike in the cases. So what is the number of, the percentage of population which is vaccinated there? So I think that will be next thing as a technologist or as a GIS specialist or a visual analyst to see, the pattern and the relationship between these two data sets. So we have this vaccination data coming up, which is, I think, good. So I think those dashboards will be adapting more towards this data. That's my kind of preamble.
Thank you very much, Dr. Ali. I now invite Dr. Gillani to not just give his own thoughts, but to react to what the other 3 panelists have said. Dr. Hammad Gillani, please.
Thank you very much, Anika. We are living in an era that is due to the pandemic. We know very much we are connected with the internet. As all of us are most of the time living our homes, and we are spending most of the time on mobiles, our laptops and different machines. So it means we are very much connected. So when we are connected even with the location base. So everyone is very much connected in terms of the location, and that location can be identified on the map also. But another thing is in terms of connectivity, we need to map these things. Like as Dr. Ali mentioned, yesterday I registered myself, And today morning when I reached office, first thing I saw the very nearest healthcare center. So it was difficult for me to go through one Excel file, and that is the only one Excel file, and that can be mapped very easily. But here the problem is in terms of the willingness, and that is through GIS, we have a lot of students, we have a lot of professionals, and we can go for crowdsourcing things, and we can map our different facilities, and also with the vaccination, we can crowdsourcing, and most of us are very much willing to go for this one and to register on the dashboard. So in this way, we will have a lot of information. And apart from this thing, as Esther mentioned about the movement of the vaccination. Other day I saw a ambulance in far away village, and that was the strange thing. Someone called the vaccination mobile, and they have vaccinated themselves. So if that vehicle we can track through GIS, and a lot of people can be benefited in those areas. So these things can be very much we can put into the GIS through dashboard, decision support system, and through crowdsourcing.
Thank you so much, Dr. Gillani. Well, I now ask my first question, which is about logistics of COVID-19 vaccination program, considering that world's entire population has to be vaccinated in urgency. The challenges are both in terms of supply chain logistics and identifying and prioritizing vulnerable populations for immunization. How can geospatial technology help achieve equitable and speedy vaccine distribution, especially in low and middle income countries? I'd like to start with Dr. Este. Would you like to comment on this?
Absolutely. I mean, my theory or belief has been since the very beginning of my time using GIS is that it's always about trying to improve equity, because basically what you're doing is you're putting things in a spatial context, you're looking for gaps in different ways, and then you're trying to mitigate what's going on in those gaps. So when it comes to vulnerable populations and supply chain logistics, I think you want to be able to direct vaccine to those who are most vulnerable. So that becomes, actually, as Dr. Orhan said, it's a data challenge, partly, because how you identify where you have vulnerabilities across a geographic space can be very challenging. For example, we took our national recommendations for how to prioritize the population, and then we worked to put that on a map. But some of those are not common data sets. For example, frontline healthcare personnel. It seems like it would be very easy. We have databases with healthcare personnel, but how do we know which ones are actually on the front line versus those in more supportive roles that are not as exposed? And then it gets more complicated from there. You can identify individuals with comorbid conditions that may be more susceptible to severe illness, but lots of people have overlapping conditions. You know, if you map your population over the age of 65, your population with diabetes, your population that's obese, your population with heart disease, you could have one person that has all of those things, right? They're a 65-year-old with multiple medical conditions. So it becomes a big challenge to get these things on a map. That said, I think with some educated calculations and some proxy measures, you can do better than if you hadn't chosen to look at these factors spatially. So that's what we've done. We found literature that tells us, you know, of all of the medical personnel in a hospital, what percentage of them tend to be clinically involved. You know, we can look at what percentage of the workforce is essential workers, given the definitions of essential in each place. So some of those are broader calculations, but it definitely does become a data challenge. The other thing that I'll just say very quickly is that the idea of vulnerability is specific to the challenge you're facing. With COVID, we have multiple kinds of vulnerability. There is socioeconomic vulnerability, there is susceptibility to the disease vulnerability, there is transmission and exposure vulnerability. You may be perfectly healthy, but you live in a place or you work in a place with crowded conditions. So we have to take all of those into consideration. So there's another benefit of mapping, is the ability to easily overlay all of these things and analyze them to find the highest cumulative risk places where you can start your efforts first.
Thank you, Dr. Este. Dr. Ali, would you like to comment?
Yes, I think, again, Dr. Este has very well summarized this, but a few of the things which are important here. Definitely the logistics, is the very nature of GIS, so you can track real time, whatever the phenomena is, and of course, it's all about the COVID-19 in terms of the, carrier of those vaccine. And again, I think it's the mapping and that complications of the different mapping layers and how to establish relationship out of that. So I think, as it's been said, that it will also be challenging for these GIS analysts and GIS specialists, even if you have the data, coming from different sources, even if it's real time. Maybe as it also in the literature, people have been very active, so what I would call it that there are certain, artificial intelligence models which have been applied along with the supply chain phenomena. So like we have artificial intelligence, we have epidemic intelligence. That's another buzzword appearing nowadays, which of course, take all those, the data aspects and the modeling aspects and the need theories and whatever the knowledge you actually gain from those data and those, data sets overall. One thing I would like to relate here is, we have this term big data, and there are certain V's associated with this, and one of them is the velocity of the data, and so the velocity is basically the speed of the data, how quickly you actually collect that data. So ideally, we have to have those, technical frameworks at the back end, which can process the variety of the data, not necessarily the location data, but it could be the data coming in all different formats. So how we can, dump all data in a kind of a database where decision making can relatively be easier. I think that's all I have to say.
Thank you, Dr. Ali. Thank you very much for your valuable remarks. My second question is to Dr. Orhan. It is regarding the lack of resource tools, especially in developing countries. In the face of this unfolding crisis in countries where technology is a drawback, how can people contribute to creating an efficient GIS system for COVID-19 monitoring and vaccine circulation? What would you like to say about this? Dr. Orhan, you have to unmute yourself.
Yep. Okay. Thanks for the question, and sorry for I mute the microphone. I will repeat once more my quote in the preamble: data, the data quality. What you use in the GIS is the most important thing, and the success of all applications that you can use artificial intelligence, you can use several systems, several models, but if you fail with the data, your most sophisticated program and most sophisticated model can fail. And therefore, in order to have a successful end of this process, we have to work interdisciplinary with as Dr. Ali said, with stakeholders. and different professionals and professional groups together. Not only the GIS specialists or data specialists to deliver the data from geospatial information, but we have to work with medicine people. Here, Dr. Geragathy is a very important individual who knows also from her background the medical transactions also. And therefore, in order to work closely with all these different disciplines, I will quote the most important ones for me, the medical part, then the mathematical, the modeling part, then of course, very, very important one in many parts of the world. I will exclude non-geographical region, the social sciences. We have to use the social sciences in our, let's say, data processing activities. And this is one of the essential tools, of course, into getting into the success of it. And this is my answer to your question, if I'm right.
Thank you so much. Dr. Gillani, what would you like to say on this?
Actually, if you see, particularly in looking to the low developing countries, if I say, at the moment, the challenge is willingness, awareness. Most of the time in our part of the world, people are reluctant, even as Esther mentioned in the US also story, it's a link very much with the personal statement to the religious and so many other factors. So the thing is, at the moment, people need to go for a vaccination, and that need to be put in a successful story through GIS. And then people will relate with them instead of taking their own assumption to we are not into going for a thing. Yes, data is needed. As Dr. Arfan mentioned, at the moment, we, as a student of GIS, we are also looking for spatial data, but sometimes non-spatial data is also very much essential, and that can be translated to the spatial data set and can put into the decision support system dashboards and to take to decision, like in areas where those areas are very remote and difficult terrain areas. So those areas can be target areas instead of only the urban population. We need also to look to the rural population where the majority of our population is poor people. So that is also we need to see through GIS, in particularly in this part of the world where the more, like if you see at the moment what is happening in India, Nepal and surrounding countries, like people are dying, and the same situation could be happen here also. But we need to bring success story to mobilize the people, to aware the people through our youth and through this our GIS platforms.
Thank you, Dr. Gillani. I would look to Dr. Esther and Dr. Ali Tahir if they want to say something to this question, if they want to add something.
I'd love to add something because the theme of success stories and crowdsourcing have both come up a few times. And I just wanted to share with everybody that, we've thought about these things as well. And we have a crowdsourced story map that is for people to add their vaccination story as a way to show vaccine confidence around the world. And I would love for more people around the world to submit their stories. So I will speak out the URL in case people are interested. It's not too hard. It's ESRI, ESRI, URL.com/I got vaccinated. And if you look at that, you can explore the world of people submitting their story, most in the US. So maybe this webinar will increase the breadth. But you can look at people's stories, and they basically share why they chose to get vaccinated, how long it took, because people care if it's convenient or not, and where they went to get vaccinated. So it's a small comment to just build on what others said, but it's a beginning to sharing some of those success stories and letting every community share their own champions.
Thank you so much, Dr. Este. Dr. Ali Tahir, would you like to say something?
Yeah, I think this crowdsourcing again is a very significant component in this era. And so we had this term in the GIS called Volunteer Geographic Information, VGI. So that was used first time in 2007. And since then, we see many examples such as OpenStreetMap and then Wikimapia, and then Google partly was also on the same model. So again, I think as Dr. Este mentioned, so ESRI map story is very good if you can share that in our local groups. But yeah, but again, I mean, this crowdsourcing, the benefit, of course, is that it's just general public who is just submitting their own data, and as a result, you are building up that locational database at the local and then eventually at the global level. So that really is a helpful thing.
Thank you so much, Dr. Ali. I will ask one more question, and then afterwards I will look to the audience and maybe we can have a few questions for the panel. My last question is about post-COVID vaccination tracking. How can spatial technology help in tracking number of received doses and predict herd immunity? Also, how can GIS boost the transparency of vaccination efforts and also promote public interaction? Dr. Ali, would you like to start with this?
Okay. I think it's a very interesting challenge for the geospatial community as well. So there are already some predictions that in the developed world, maybe this vaccination process may be mostly completed by end of this year. And there have been talks going on about the booster shot in 2022, if ever needed. But of course, the developing countries are falling still behind it. But one good thing is coming out of this, that of course data is being generated, data is being gathered, and as you know, data quality has been talked about. So the more data we will have, the more authenticity we will have on this. So I see that GIS has a vital role in this, and the local conditions, the global conditions can be mapped much in detail. And of course, again, it's a multidisciplinary thing. So the overall purpose is the public safety. So yes, I think GIS, as every other technology, is evolving. So with this much data, I think we can do a lot. One thing is that, GIS is strongly supported by this technical kind of developments, especially from the computer science domains. So those, those things will definitely help. The technology itself is growing, the data processing capabilities, one other thing I would like to mention is about the stakeholder, but we have a thing called web services, the integration of data where one can share data like immediately without posting it to the main servers. So with those kind of, latest development, and especially in the GIS world, so we have this Open Geospatial Consortium who is also working actively on making different standards on location and all that. So I see there will be a better for the humanity overall, and
Thank you, Dr. Ali. Dr. Orhan, would you like to comment?
Every time when I see this, I am a person relying always on data. And therefore, we have to be open for every kind of data we can achieve. And there are some barriers in our society, in our legislations also, especially with our human data with our health data and sharing the health data. Unfortunately, this pandemic has been combating with all these barriers now, especially with the social tracing and distance tracing, etc. And also in my country, we have on our mobile maps showing us that we are 2 times vaccinated, and the Bluetooth is open every time, has to be open every time, telling my health condition to the next person or to the group where I am participating. And it shows me my region, not individually, but impartially, where the regions are very much vulnerable and having people with COVID-19 infections. So take care if you enter these areas, etc. These success stories together with other supporting mechanism, as Dr. Tahir said, this will help for the success of the vaccination.
Thank you, Dr. Orhan. Dr. Gillani?
Just one comment. As we are getting the vaccinations and we are vaccinated and we are coming to the normal routine life side and slowly, but looking into the post-pandemic situation, as we are getting so many information, and as Dr. Arfan mentioned and Ali, about the data, and we are gathering, yes, at the moment in few part of the world it is not geospatial, but eventually it is going to be spatial whenever any person will do some spatial analysis, and this particular information will link up with our immunity system, who are going to use this information in different part, in different eras and in location based, and that will be very much useful for different people, and particularly in the scientific geospatial community.
And finally, Dr. Este, what do you have to say?
So I'll comment on 2 parts of your question, the tracking of booster shots as we go forward, and then the prediction of herd immunity. So the tracking of boosters and how we do that going forward, I don't think it's any different, but your question sort of brought up one of my biggest fears, and that is that post-pandemic, mindsets will change and everybody will shut down existing systems instead of enhance them and continue them. Why would we not take what we've learned and make it better and move it forward? Seeing how critical it's been and how important it is to be ready for whatever crisis. There's always crises happening that will come next. So I don't think that tracking the booster should be any different than tracking everything we've been doing now. The major difference is anybody who hasn't connected to their systems of record can do that instead of transferring data from one system to another. Let's automate these processes and keep this real-time data flow that's helping us so greatly at this point in time. When it comes to predicting herd immunity, I wanted to give a shout out to one of our business partners. They're called Epistemics, and it's a clever name. Anyway, what they do is they have an agent-based modeling system, which is pretty unique. We've seen a lot of the SIR and SEIR models, but they've basically created and can do it for any country that has some of the data, a digital twin of that country's population. When you have that, you can also start to model behaviors and movement and all of these different things. And so what they're able to do with that is iteratively predict, with vaccination levels increasing and social distancing behaviors and the current transmission rates in communities, they can predict for every community at whatever size you're interested in when they reach herd immunity. recognizing that although we talk about herd immunity as being in the 70 to 85% range, it's different for every community. A community that is sparsely populated and has lots of space is going to achieve herd immunity faster than a community that's densely populated. So they've brought that spatial and temporal aspect into constantly re-predicting herd immunity using GIS. So it's a pretty cool tool, and it can be done. But I think the big lesson here is that herd immunity is not a global number, it's a community-based number.
Thank you so much, Dr. Este, and thank you very much for this great discussion. I hope you all enjoyed this. Now we'll be taking questions from the audience, and we'll give each member a chance to reflect on any aspect of those questions. So the first question that we have from the audience is that how well does GIS compensate for physical on-site surveys in terms of feasibility and runtime expenditures when the available workforce outnumbers the technological resources? So Dr. Orhan, would you like to start with this?
Question very well. The success stories is the most important thing to reach the end what we are wanting, because this pandemic is the first one. The first one we are having it globally. It started with this century, this millennium with SARS, then afterwards with all these transportation devices developments, and also the different relations between all communities, and also brought this pandemic to us. And all of them, we have to be prepared, as Dr. Geragathy said, with all these simulations for further pandemics and the behavior, social behavior of the societies altogether. And this is a very, very important one, so that we are prepared for the post-pandemic. And the post-pandemic is very important. I got every time, every winter before this pandemic, flu, 2-3 times even. Now I'm wearing masks all the time and avoid some very near contact. Last year and this year, I haven't had any flu. This might be a good example looking into the diseases in the society, which has been in the past as a general example. I have seen several examples, close my friends, they say, I haven't had any cough in the last year. And some of them said, I haven't had this one, but we are vulnerable for a disease, and this brought us to a very protective matter. That's all.
Thank you. Dr. Gillani, what would you like to say?
I fully agree with Dr. Arfan, what he said. Yes, success story is the only way out. We have to come out, we have to speak up, we have to tell the people, yes, we all are sitting here, we are educated, we know very well how this vaccine is developed over the time, and we were waiting for this, and now we are willing to get the vaccination. But the thing is, we need to bring the GIS to the public through different platforms, like just from web to the mobile app, from different success stories, crowdsourcing, algorithms, different maps, stories. So this is the only way out from my side.
Thank you. The second question that we have from the audience is particularly about Pakistan. So in Pakistan, and I believe in a lot of other developing countries, the people very much believe in mixed like side effects of vaccine. So can GIS play any role in increasing the public confidence on vaccine? There are many people who are hesitant about getting COVID vaccination. How can GIS help if people don't get the second dose of the vaccine on just the first one? So Dr. Este, would you like to start on that?
Sure. I think GIS helps in what may feel like a non-GIS way, and that is by using, at least in terms of ESRI products, we have one product that's called ArcGIS Hub, and this is basically a website builder. And what it allows you to do, though, is on your website provide clear information, multiple different kinds of apps, progress, those success stories that we all talked about. And so I think part of it is just making sure that you have clear and engaging communication. Now, in some countries, I think that that's a real challenge because many people maybe don't get their information online. So maybe you have to make sure that everything is accessible through smartphones and other means. But GIS can allow you to communicate. You can communicate in a map-based way, which people tend to engage with. And I think you can also do those things that I mentioned briefly in the beginning, which is understand what some of the underlying norms are for a particular community. You may approach a community and find that they're not showing up for vaccines. They have a high level of hesitancy, and they're mostly service workers. And maybe that implies some level of messaging that would be different if you had high-tech workers or different communities, or if that community is mostly families versus more older retired folks. You're going to have different messaging that you provide. You may pull in different community partners, whether it's your faith-based organizations or other nonprofits who can connect directly with the people that they serve in that community to help push forward the ministry's messages of the success stories, the safety of the vaccine, and all of these different things. So like I said, it's GIS tools, but maybe not always directly map-based.
Dr. Ali, what would you say to this question?
Well, I would say that definitely GIS is an essential tool, and it can definitely help, but maybe not strongly convince, given the orthodox thinking and all sorts of beliefs. But one thing which is coming, that people are saying that eventually your passport will be stamped whether you are vaccinated or not. So, future traveling will be linked with that. Who knows that future buying on e-commerce will also be linked with that. I mean, unless you're vaccinated, you'll be allowed to purchase from Amazon, for example. But of course, there are stories. So only the downside is that, there are a few debates already going on that even people got vaccinated, they got both the doses, but even then, they are getting COVID positive, for example. So these data are also coming in. So I think it will be only the time once we know the exact situation. But definitely, the more we can visualize and, the more results we can show through different departments, through public portals and as these success stories. So I think more, citizens will be convinced.
Thank you. Thank you, Dr. Ali. And the last question from the audience today, what should the government do to help GIS prevent, especially with regards to COVID vaccination? And I would like all of you to answer this. So we can start maybe with Dr. Ali. I'd like to start.
So your question is what government should do to promote GIS in COVID
Yes.
vaccination?
Yes.
Okay. Well, if we talk locally, I think I would say that GIS started a bit late, as far as our country is concerned, but now there's more awareness. There are more degree programs, and there are more GIS professionals across the country, and they are kind of harnessing the, importance of this technology and applying in multiple domains. I think efforts are already underway. If we go back 5 to 6 years or even 10 years, so there were relatively less people who knew what exactly GIS is, but it's not the case anymore, which is a good thing. So I think we have this Ministry of Information Technology. I'm also part of some of the policy making of it. So we strongly, gave some of the recommendation and requested to include this GIS as a policy at the national level. So not only the e-government, but also, we introduced the term G-government, GIS-based and location-based stuff. So I think efforts are underway. And this national center itself is the first of its kind, where you are hosting this webinar. I think this is the first time in Pakistan that much level of funding has been done by Planning Commission. So that's a welcome sign.
Thank you. Dr. Orhan?
The most important thing is that with all these tools, and you have to convince the decision makers, the politicians, so that this helps to the health of the society. And the next one is that with the use of these tools like GIS and data collection, the data dissemination, etc., you are having an economic benefit also from it, because the decision makers, the politicians, always look what is the economic benefit of it. And therefore, we have to convince the decision makers on the success of the GIS application.
Thank you, Dr. Altan. Dr. Gillani?
Yes, in most of our organization, different ministries, the GIS in place. The thing is that need to be in a integrated manner, like different organizations can have willingness to sit together and bring out a common platform where they can actually put together the data and then take a decision. As Dr. Irfan, Dr. Ali mentioned about this is the only, not a single user, single admin work. This is a common platform. GIS is right now is a community is kind of team. It's not an independent kind of we can sit and can work on our desktop. No, it is the part we have to take along the line of policymakers, the public, as well as our different users. So then we can build a comprehensive platform and better effective way we can communicate.
Thank you, Dr. Gillani. And finally, Dr. Este Geragathy.
Well, I guess I look at this in two phases. I think there's during the crisis with COVID, and then I think there's what governments do after. So during the crisis, everybody feels overwhelmed and overworked. So I think the use of GIS at that point needs to be used in a very specific, high-value way to answer really clear questions or to enhance existing workflows and make them more efficient or more effective. That may be maps and dashboards and communication methods. But I also totally agree with what Dr. Orhan was saying, that you need to track ROI, your return on investment, and how that's going to position you for the future. So the future after COVID, how should government work on GIS? I think that's starting with building the foundation, the geospatial infrastructure. Basically, it's building a strategy. What do you want to accomplish with GIS over what period of time? And then marking off those milestones. How do you get there? You need training of your staff, and that's an ongoing training. A lot of times we see organizations like train once and then, technology moves quickly. So you have to have this program of constant review and enhancement of skills. And then I think it's also important to get help from professionals when needed. A lot of governments have this desire to build everything themselves, and it can be a lot more efficient if you get help when you need it. So I think geospatial strategy, ongoing training, getting help when you need it can really position governments to make effective use of GIS for their workflows.
Okay, thank you so much. And with this, we come to an end. NCGSA is actually helping spread awareness through GIS by different means. We're trying to hold seminars and different workshops so that we as an organization could help create awareness. And with this, we come to an end. Let me conclude by thanking all of our members of the panel for excellent insights into the questions that were raised. Thank you very much. And thank you all for attending. We hope you have learned and enjoyed this discussion. Thank you for joining us today and have a great day ahead. Thank you. Bye.